Hi everyone. Today I am going to give a lecture video on TORCH complex. The TORCH complex is a medical acronym of the set of perinatal infections that can lead to several fatal abnormalities or death. There are group of viral, bacteria and protozoan infections that gain access to the fetal bloodstream transparently via the chorionic villi. The torch, prevention of torch is T means toxoplasmosis, O means other infections, R means rubella, C means cytomegalovirus, H means herpes simplex virus. Other infections syphilis, varicella zoster virus, polio, mumps, etc. So the toxoplasmosis, it is caused by the protozoan intracellular parasite Toxoplasma gondii. Mode of transmissions: fecal-oral route by eating infected raw cooked meat or through contact with infected cat feces or through placenta, oocytes, contaminated soil, salads, vegetables. The life cycle of toxoplasmosis or the cat is the host here. It can spread unsprotted oocytes passed in fecus. It will spread from sporulated oocytes through the ingested by intermediate host, which transfers to the contaminated food and water. The human has inhaled that and it transferred to the fetus. The clinical manifestations are it affects 0.3 to 1% of pregnant women, which can approximately 60% transmissions the rate of fetus. Risk increases with gestational age. Primary maternal infection in pregnancy, infected rate higher with infected in third trimester, fetal death higher with infection in first trimester. The clinical manifestations are premature baby, intrauterine growth restrictions. If the baby got intrauterine growth restriction, the baby got the autism or Down syndrome. And jaundice, hepatosplenomegaly, myocarditis, pneumonitis, various rashes, anemia, thrombocytopenia, and abnormal CSF findings. The CSF means cerebrospinal fluid. It is the protecting layer of the brain and spinal cord. And the triad means the chorioretinitis, that is the inflammation of the choroid, thin pigmented vascular coat of the eye. Hydrocephalus, the hydrocephalus means the accumulation of the fluid in a head region. And the intracranial calcifications, the deposition will occurs in the cranium regions. These are the example. First one is choroid inflammation, that is chorioretinitis. The retina gets inflamed and the color is turned to dark reddish in color. Second one is calcifications of the brain. The another one is hydrocephalus, head of the baby. The next one is congenital rubella. The classification features of a syndrome produced by TORCH complex are seen in congenital rubella. The fetus include ocular defect, cardiac defect, central nervous system manifestations, sensorineural deafness, thrombocytopenia, and hepatosplenomegaly. The signs and symptoms are infected pregnant women will get usually no clinical manifestations, although some may have a regional lymphadenopathy or occasional chorioretinitis. Similarly, infected neonates are usually asymptomatic at birth. The diagnosis is serum immunoglobulins gamma measurement for the maternal infections and amniotic fluid PCR for fetal infections, serological test, brain imaging, cerebrospinal fluid analysis, and alternative evaluations for neonatal infection and PCR testing of various body fluids or tissues. And then we are moving to the treatment part. In pregnant women with established recent infections, spiramycin 3 gram daily indicated doses should be given. In neonates, pyrimethamine 50 mg twice daily for 2 days, then 50 mg daily, plus sulfadiazine 75 mg per kg daily in 2 divided doses for 2 days, then 50 mg per kg plus folinic acid 10 to 20 mg daily. So this is the treatment for the TORCH complex. The reference is the textbook of pathology. The author is Hatchmohan. Thank you.